What will happen to Donald Trump if RFK Jr.'s vaccine policy fuels lawsuits? What happens when political ambition collides with public health policy? In the middle of Donald Trump's mounting legal troubles, a new storm is brewing, this time linked to RFK Jr.'s controversial vaccine agenda. Critics warn that his proposals could open the floodgates to nationwide lawsuits, dragging not only the healthcare system, but also Trump himself deeper into a web of liability and political chaos. Could Trump's past handling of the pandemic, his statements, and his alliances come back to haunt him in court if these lawsuits gain traction? And more importantly, how might this reshape his already fragile political future? Stay tuned as we break it down right now. The intersection of public health policy and partisan politics in the United States has always been a space fraught with tension. But under the Trump administration's alignment with Robert F. Kennedy Jr. and his vaccine skepticism, we are now witnessing a level of institutional instability that could reshape the political and legal landscape. The central question we must ask today is what happens to Donald Trump if RFK Jr.'s controversial vaccine policies that restrict access, encourage lawsuits, and undermine long-established science, trigger a wave of legal battles across the country. This analysis will examine the sequence of events beginning with mass resignations at the CDC, the removal of experienced health leaders, and the newly announced restrictions on vaccine access. It will evaluate the direct consequences of these changes for public health, the risks to the legal and medical communities, and the political blowback awaiting Trump as the man at the center of it all. The implications stretch far beyond epidemiology. They strike at the core of governance, trust, and Trump's own political survival. RFK Jr. has long been associated with anti-vaccine activism, often framing himself as a crusader against what he calls government overreach and pharmaceutical interests. Now, positioned inside the Trump administration, he has leveraged that ideology into formal policy. The most dramatic change came with the announcement that access to COVID-19 vaccines would be severely restricted. Instead of being able to obtain boosters directly at pharmacies, individuals must now first secure approval from a physician. On its face, this policy appears to emphasize caution, but the real effect is far more restrictive. For millions of Americans, especially those in rural areas or those lacking health insurance, seeing a physician is neither affordable nor practical. Pharmacies have been the front-line access points for vaccination, ensuring widespread coverage. By cutting off that pathway, Kennedy effectively throttled vaccine access. Even more alarming is the explicit encouragement of litigation. Kennedy signaled that doctors who go against his imposed restrictions could face lawsuits. This creates a chilling effect. Physicians, even when believing strongly in the medical necessity of a vaccine, will hesitate if they know legal action could follow. In practice, this pits patients against providers, further destabilizing an already strained healthcare system. The immediate institutional fallout has been dramatic. The director of the CDC, Susan Mons, was ousted after refusing to implement Kennedy's directives. Alongside her departure, 3 senior officials resigned: the head of the zoonotic division, the medical officer, and the chief of the vaccine unit. These were not fringe bureaucrats. They were highly experienced figures with bipartisan respect. The resignations illustrate the depth of internal resistance within America's premier public health agency. For decades, the CDC has been a symbol of scientific authority, guiding the nation through pandemics, epidemics, and outbreaks. To see its leadership crumble under political pressure is not simply a personnel crisis. It is a symbolic collapse of trust. Moreover, the loss of expertise is particularly damaging. These were specialists in respiratory viruses, zoonotic diseases, and immunization strategy. Replacing them with loyalists aligned with Kennedy's skepticism risks turning the CDC into a hollow shell. Without trusted experts, public communication collapses, misinformation spreads, and ordinary Americans are left unsure whom to believe. The legal consequences of Kennedy's directives are staggering. By redefining vaccine access rules and rescinding emergency use authorizations, the administration has created a fertile environment for lawsuits. 3 primary categories of litigation are foreseeable. First, malpractice lawsuits against physicians. Doctors who prescribe vaccines contrary to Kennedy's policy may be targeted, leaving them vulnerable to financially ruinous litigation. Second, constitutional lawsuits against the administration itself. Limiting vaccine access raises serious questions under equal protection, interstate commerce, and the federal government's obligation to safeguard public health. Civil liberties groups and states' attorneys general are already poised to challenge such restrictions in federal court. Third, employer liability suits. Companies that require vaccination for workplace safety may now be entangled in disputes if employees sue, citing Kennedy's restrictions as evidence of government opposition to such mandates. Each of these legal paths ensures prolonged courtroom battles. With healthcare providers trapped between medical ethics and political edicts, litigation will proliferate. The sheer volume of lawsuits could overwhelm courts, forcing judges into the uncomfortable position of adjudicating scientific questions. While RFK Jr. may be the architect of these policies, the political consequences land squarely on Donald Trump. As president, he bears ultimate responsibility for the administration's actions. Several political risks immediately emerge. First, Trump's alignment with Kennedy tarnishes his standing among moderate voters. For years, Trump has cultivated the image of a strong leader who delivers results. Yet, by embracing policies that restrict healthcare access and alienate medical experts, he risks appearing reckless and indifferent to American lives. Second, the lawsuits that follow will drag Trump into prolonged public scrutiny. Every headline about patients denied access to vaccines, every story of a physician bankrupted by legal fees will tie back to his administration. Opponents will frame these policies as not only misguided, but deadly. Third, Trump's handling of the COVID-19 pandemic remains one of his most vulnerable points politically. Critics already accuse him of downplaying the crisis and ignoring science. Adding a new chapter of vaccine restrictions only reinforces that narrative. The human cost of Kennedy's policy is immense. By limiting vaccine availability to adults over 65, thousands of younger Americans with underlying conditions, multi-generational households, or personal health risks are excluded. COVID-19 may no longer dominate headlines as it once did, but it still sends thousands to hospitals each year. Long COVID continues to disable countless individuals. Vaccines remain a vital tool, not merely an optional precaution. By denying access, the administration invites preventable hospitalizations and deaths. Emergency rooms will absorb the burden, healthcare workers will once again be strained, and insurance systems will see costs spiral. This public health fallout is not hypothetical. It is the predictable outcome of undermining scientific consensus. In addition, discouraging vaccines emboldens extremist groups. Already, anti-vaccine rhetoric has inspired violent attacks, including a domestic terrorist assault on the CDC itself. When the government adopts similar rhetoric, it validates these groups, increasing the risk of further violence. The resignation crisis at the CDC highlights a deeper problem: the deliberate erosion of expertise. In modern governance, institutions rely on specialized knowledge to navigate crises. When experienced officials are replaced with ideological loyalists, decision-making quality declines. History provides sobering parallels. In authoritarian regimes, purges of experts in favor of political sycophants consistently weaken state capacity. Whether in economic planning, military strategy, or public health, loyalty has never proven a substitute for competence. For Trump, this erosion has dual risks. Domestically, it fuels the narrative that his administration is incompetent. Internationally, it undermines America's credibility in global health cooperation. When foreign governments see respected scientists driven out, they will hesitate to trust American leadership in future crises. One pivotal figure in this unfolding drama is Senator Bill Cassidy, a physician by training and the chair of the Senate Health Committee. Cassidy played a critical role in Kennedy's confirmation, securing commitments to protect vaccines, commitments Kennedy swiftly violated. Cassidy now faces a crossroads. Will he continue to shield the administration, or will he publicly oppose Kennedy's policies? His decision carries weight not only for his political legacy, but for Trump's stability. Should Cassidy break ranks, it could embolden other Republican lawmakers to resist, fracturing the coalition Trump relies on. For Trump, This is dangerous. Internal dissent from respected Republican figures undermines his control. Moreover, Cassidy's medical background lends credibility to critiques of Kennedy's policies. Unlike partisan attacks, his opposition cannot be dismissed as political theater. It would be rooted in medical expertise and personal integrity. To understand Trump's vulnerability, we must envision how lawsuits could unfold. Consider the case of a 40-year-old immunocompromised patient denied a booster shot at a pharmacy due to Kennedy's restrictions. If the patient contracts COVID-19 and suffers severe consequences, their family may sue both the pharmacy and the administration for violating established medical standards. Alternatively, imagine a physician who, out of professional obligation, prescribes the vaccine despite Kennedy's policy. If sued by an anti-vaccine group, the physician might countersue the administration for placing them in legal jeopardy. In both scenarios, the Trump administration becomes entangled in litigation. Even if ultimately prevailing in court, the process itself ensures damaging headlines, sympathetic plaintiffs, and a constant reminder of the human costs of the policy. Trump's political survival has always hinged on controlling the narrative. Yet, the vaccine lawsuits threaten to create a narrative he cannot easily spin. Media outlets will highlight stories of suffering families, overburdened hospitals, and disillusioned doctors. Images of grieving relatives will resonate far more than political talking points. Furthermore, Trump's opponents will tie these stories directly to his broader record on COVID-19. The message will be simple. Trump ignored science, undermined health agencies, and Americans paid the price. Social media will amplify these stories, spreading outrage across the political spectrum. Even conservative outlets may struggle to defend policies that leave their own viewers vulnerable. The narrative war will tilt against Trump, constraining his ability to shift focus onto other issues. Beyond Trump's immediate political risks, Kennedy's policies threaten to permanently damage the architecture of American public health. If lawsuits proliferate and doctors fear legal exposure, fewer medical professionals will be willing to engage in vaccine advocacy. The chilling effect could extend to other areas of preventive medicine. If political leaders can redefine medical standards for vaccines, what prevents them from doing so for cancer screenings, reproductive health, or mental health services? The precedent is alarming. Moreover, the erosion of bipartisan consensus on vaccines risks polarizing medicine itself. Once a realm of broad agreement, public health could become yet another battlefield in America's culture wars. America's vaccine policies have global significance. During the COVID-19 pandemic, the United States was both a producer and distributor of vaccines worldwide. Allies relied on American guidance and leadership. If U.S. policy now shifts toward restriction and skepticism, it sends a destabilizing message internationally. Countries struggling with outbreaks may hesitate to adopt vaccines if the U.S. appears ambivalent. Adversaries may exploit the confusion, spreading disinformation to weaken global trust in American science. For Trump, this international fallout adds another layer of risk. As he seeks to project strength abroad, allies may view his administration as unreliable, undermining diplomatic relations. While Trump typically shields himself behind institutional authority, the legal chaos surrounding vaccines could test those boundaries. Plaintiffs may attempt to name him personally in lawsuits, arguing that his direct alignment with Kennedy constitutes negligence or malfeasance. Although courts traditionally shield presidents from certain forms of liability, the unique circumstances of deliberately restricting life-saving medical access could test those protections. Even if dismissed, the mere act of being named in such suits erodes Trump's image of invulnerability. Looking ahead to future elections, the vaccine lawsuits could become a defining issue. Suburban voters, particularly parents concerned about their children's health, may turn against Trump. Senior citizens, ironically the group still allowed vaccine access, may nonetheless recoil at the broader instability and loss of expertise. Democrats will seize the opportunity to frame Trump as not only anti-science, but actively dangerous. Republicans, already fractured, may see growing internal dissent. Swing states with large healthcare sectors, such as Pennsylvania, Michigan, and Wisconsin, will become especially volatile. If lawsuits dominate headlines during campaign season, Trump risks bleeding support among moderates and independents. His base may remain loyal, but electoral victory requires a broader coalition. The convergence of RFK Jr.'s vaccine policy and Donald Trump's political ambitions is a combustible mixture. By restricting access, encouraging lawsuits, and hollowing out the CDC, the administration has created a legal and political crisis. The lawsuits that follow will not merely challenge doctors or pharmacies, they will challenge Trump himself. What happens to Donald Trump if these lawsuits gain traction? At minimum, he faces prolonged political damage, a fractured Republican coalition, and diminished credibility with the public. At worst, he could become the first president held legally accountable for deliberately obstructing life-saving medical care. In either case, the consequences are severe. Trump has tied his fate to Kennedy's anti-vaccine crusade. If the courts, the medical community, and the public respond with outrage, Trump may find himself cornered, his political capital depleted, his legacy tarnished. The lesson is clear. Public health is not a partisan game. When leaders gamble with science, it is not only institutions that collapse, it is their own political futures.